Hi, this is Dr. Justin. Thank you for subscribing to our video on female hormone balancing. The goal of the video is to provide you additional information in regards to what you can do to help balance your female hormones naturally. The goal is to give you some information on what the conventional approach is, to be able to compare and contrast to what the natural approach is, and so you understand what the underlying driving factors of your female hormone balancing are, and for you to walk away more educated and feel more empowered to actually address the underlying cause of the problem. Again, ahead will be the video. For any questions, feel free and reach out to justinhealth.com and or email the office. Thanks. Enjoy the show.
Hi, this is Dr. Justin Marchegiani here. Today's talk is on female hormone balancing. And this talk essentially just goes over the underlying imbalances that drive female hormone issues. And this can be anything ranging from PCOS to PMS to infertility to menopause and the myriad of symptoms that essentially surround female hormone issues such as hot flashes, cramping, bleeding, breast tenderness, bloating, the whole 9 yards. And we're going to just go over it and just make sure everything makes sense in regards to the underlying biochemical and physiological imbalances that lead to these symptoms. We're going to go over what's driving these issues and then essentially give you some simple solutions that you can do afterwards on how to move forward to get some specific answers that may be causing your underlying issue. So as we move forward here, taking a look at how your normal cycle actually works. Let's take a look at that. So we have our monthly cycle here, and I kind of break things up into essentially three phases. We have our follicular phase, we have our ovulation, this is the time of the month where we can get pregnant, and we have our luteal phase. And just to keep things simple, we have our upstream hormones right in this area, and these are the conductors that signal down below essentially to the glands, ideally the ovaries, to make hormones. And so our cascade is typically like this. We have predomination of estrogen in the first half of the cycle, and that's signal from our upstream hormones. When estrogen peaks, we make this hormone over here called LH. LH then raises progesterone up, and progesterone predominates throughout the second half of the cycle. So you can see where estrogen drops and progesterone starts to rise is the area where pregnancy can occur. So some of the main issues that drive female hormone imbalances: one, we may not have a long enough phase in the follicular phase. Estrogen may not rise up gradually. It may rise up erratically like my mouse is showing. Some of the big things that happen in the progesterone phase is progesterone may fall out early. And this happens because progesterone essentially is the precursors to our cortisol or our stress hormones. So many people know cortisol essentially is our help us with energy, or it essentially helps us with pain and inflammation. Cortisol and cortisone are derivatives. So people maybe have gotten a cortisone injection in a painful area. It really is the same thing. So what's happening is any type of stress, whether it's blood sugar, whether it's emotional stress, whether it's physical pain, all of these things are going to take progesterone and convert it into cortisol. And that's what you're seeing in a lot of these second half of women's cycles. And essentially, estrogen's main job, as you can see up here, is to thicken the uterine lining. And progesterone's main job essentially is to help it differentiate and mature the uterine lining, so when the egg pops out above, it can actually implant into this lining and hold true, ideally, to fertilization until we have a viable egg that turns into a fetus. So essentially, recapping, first half is estrogen based. We have this nice drop in estrogen, which then signals a rise in progesterone. If we're not stressed, then we are going to essentially keep our progesterone levels up. If we are stressed, and there are many different kinds of stress, our progesterone drops out early. And if we don't have a nice drop at the end of our cycle, then we're not going to get that nice signal to bleed or to menstruate. So when we bleed at the end of the month, it really should only be 3 or 4 days if we have a healthy drop in progesterone. If you're going longer than 3 to 4 days, something is wrong with the cycle and it needs to be fixed. So moving forward, this is actually a month-long cycle we've taken with one of our patients, and as you can see, estrogen's all over the place. Below is how it should look. The first half, estrogen should predominate in the follicular phase, and then it should drop off. And as you can see, looking at her progesterone side of the cycle, this is progesterone above and estrogen, estrogen up top and progesterone below. Progesterone should look like this. It should be a steady rise in progesterone. Again, not falling out early, but again, if you can see our patient above here, that's just very erratic. So think of every single up and down here of hormone spike and drop as just being a really, really bad day. So she's not feeling too happy. So again, the adrenal glands enter the conversation because the adrenal glands are essentially the backup generator for our sex hormones. Almost 50% of our sex hormones come from our adrenal glands. So having healthy adrenal function is very, very important. You can think of our adrenal glands as our backup generator. So again, they're very important for women that are essentially perimenopausal or even essentially menstruating females. They are very important, but they become even more important once a woman enters into menopause because the majority of their hormone output is actually going to be coming from the backup generator or their adrenal glands. So again, this kind of gives you a detailed picture of what's happening. So we talked about the conductor controlling the orchestra. This is complicated. We're going to make it really simple. The conductor essentially is our brain. We make various releasing hormones, whether it be LH or FSH, and these scream down to essentially our ovaries. But in this example, we're looking at our adrenals and we're looking at our thyroid. And what happens is we have these feedback loops that are controlled essentially by the thermostat. So the thermostat essentially are our feedback loops. So to keep it a little more simple, we have feedback loops that go back and forth. So kind of like a thermostat works, if the thermostat is set for 70 degrees and the temperature starts to rise over 70 degrees, the air conditioning will kick on to lower it. And thus, if the temperature drops below 70, 68, 67, the heat will rise on and bring it up. So think of these feedback loops as a thermostat. And again, our adrenal glands are predominantly pumping out sex hormones and cortisol. So sex hormones being progesterone and estrogen and some testosterone, and cortisol primarily being essentially our glucocorticosteroid cortisol, which helps do two things: regulate blood sugar and energy, and help regulate inflammation and stress. And then over here we have our thyroid gland that pumps out T4, and then T4 has to be converted into our active thyroid hormone T3. So inactive T4, active T3, and there's a lot of different nutrient steps that need to be present for this conversion to happen. So again, we have a whole bunch of stress that may occur, and the shaking is symbolizing active stress. It could be blood sugar, chronic pain issues, toxins in the environment, heavy metals, infections. All of these things can drive stress. And if you remember before, progesterone can then get converted into cortisol. So watch what happens to the feedback loops here. The feedback loops become disrupted. So think of essentially the thermostat becoming broken. We're making less sex hormones from our adrenal glands because we're converting more of our substrate into our stress hormone cortisol. And again, we're making less T3 and we're making actually more reverse T3. So think of reverse T3 as the brake. All right, and T3 as the gas. So the body essentially is halting its energy, it's halting its reproductive and healthy hormone capacity because it's just saying, hold on for the ride. It's really stressful. We got to hit the brake. And that's what's happening here. And the overall goal really is to actually address the underlying issues above and pull off these feedback loops and pull off these inhibiting pathways so feedback can then happen again. So again, we're here and we want to be here where we have ultimate communication. So moving forward, we'll be talking about our adrenal glands a little more. So first things first, how do our adrenal glands work? Well, they're actually functioning on a circadian rhythm. What that means is they function on a light and dark cycle. So as you can see in the morning, they have the highest amount of cortisol being pumped out to help us get up and to help us function and have energy. And at night, cortisol is the lowest, essentially so we can wind down and relax and go to sleep. And so what happens when we become stressed, this rhythm may not be a nice smooth drop. It may be a little more erratic. Or we may be having a high amount or even a low amount. So there's two things we're looking at here. We're looking at up and down flows, not an even drop, and we're looking at high and or low. So there are tests we can actually do to see how our adrenals are functioning and compare it to what a normal adrenal gland should do. So moving forward here, you can see we have our cortisol rhythm test. We have high normal and we have low normal here, and our patient's way above. So you can see she's very high. Her second value is still very high, especially according to the graph, and then she drops below. So kind of like that first scenario we gave you, high, high, and then low. So we have a really aberrant or disorganized rhythm. And looking at our second patient here, we have high normal, we have low normal, and the patient's essentially just skirting on the outskirts, just at the very lowest you can be, barely being in range. So she's going to have fatigue and probably not going to feel too well either. So again, let's talk about hormonal balance. So again, as you get older, ovarian function is going to decline. That's inevitable. But again, what allows you to have hormonal balance is our adrenals are able to pump it up, to step up, and again, hormonal harmony happens because our adrenals are here as the backup generator. Now when our hormones are out of balance, what happens? Ovaries stop functioning, and again, our adrenals, they can't quite kick it up. So again, we're going to have really bad menopause symptoms. And not to mention, if our adrenal glands aren't stepping it up, we're going to have all kinds of energy symptoms, all kinds of PMS symptoms, and maybe even infertility symptoms as well. So this kind of is a guideline to what most stressed out women, essentially, who have PMS symptoms or even infertility, this is what they're looking forward to if they don't address it. Even worse symptoms in menopause. And I emphasize this because the conventional modalities or methods for treating hormonal imbalances really are terrible. They tend to either rely on birth control pills or essentially antidepressants. And both of these modalities do not address the underlying cause. So let's take a look at where these hormones are coming from. So again, we have cholesterol, right? Cholesterol is actually the raw material for all our hormones. I know it's been given a bad rap, but this is really important as if you don't have the raw materials to build something, it's very hard to build it. Like if you have a deficiency of wood when you show up to the construction site, it's going to be really hard to start the build on your house. So you can see all of your hormones come from pregnenolone, and we make all of our hormonal byproducts, whether it's cortisol or cortisone, whether it's our female hormones, estrogen, progesterone, or whether it be our testosterone or androgen hormones. And again, even females will be making some of these to help with sex drive and libido, of course. And when we have a stress response, this black arrow becomes facilitated. And what's happening is we're making more cortisol or cortisone. And as you can see, progesterone is the raw material for it. So the more we get stressed, like we showed in the first half of the cycle, progesterone becomes depleted. And this really is the hallmark of any infertility issue, of any PMS issue, of any hormonal imbalance is going to start with a stress response, essentially pumping progesterone into our stress hormone. So the goal really is to take away the stressor, so our body can start using its progesterone and not burning it up, and then we can create more of a reservoir or a supply of our healthy aging hormones so we can age gracefully, and if we desire, have a healthy child and or go into menopause gracefully. So to keep it simple, that last slide was really confusing. We have our hormonal pool above, and again we're making stress hormones, whether it be cortisol on one side, just called stress hormones, and we have our anti-aging or rebuilding hormones on the other side. Think of this as progesterone, estrogen, and some testosterone. So when we have a stressed out response, again, our stressor coming from above, we are making more stress hormone, and again, our anti-aging hormones or our sex hormones are being depleted. The body is hardwired to say, okay, we don't have time to deal with getting pregnant. We don't have time to worry about having healthy skin and muscle and brain function. We just have to deal with this stress. But the problem is today we're just in this chronic stress response. So we just become depleted, and our performance and our ability to perform and function well essentially is just on low the majority of our lives. So the solution really is pull the stressor out and allow the natural balance to occur where we're making healthy hormones and decreasing our stress hormones. So again, we have our chief female hormones, estrogen and progesterone. These all affect our neurochemicals, such as serotonin, which has effects on mood and depression, dopamine, which has effects on focus and attention, and GABA, which has effects on relaxation. So all of these are very important for just us feeling good. And so this is us maybe at certain times of the month we feel really good, and then maybe we hit that dreaded PMS cycle maybe around day 24 or 25, if our cycle is typically 28 days, and then we start to notice our hormones start to go out of balance, maybe our progesterone starts dropping, which then affects our neurochemicals, and we start to feel like this. We may not look like this, but on the inside we may feel like this. And this does not have to happen. There are simple natural protocols and diet and lifestyle things we can do to help fix this issue. So action items, let's talk here. What can we do about it? Well, if you're having issues, we should get our adrenal and female hormones assessed. I mean, if you're not assessing, then you're guessing. You really want to look and see where your body, where your biochemistry, and where your physiology is at. And from that starting point A, then you can figure out how to get to starting point B. If you have a map and you're trying to get to someplace, you have to know where you are on the map first, and then you can draw out the route to get there. So again, evaluate where your stress is coming from. To keep it simple, stress comes from three main sources: physical, chemical, or emotional stress. So we need to sit down and have a talk and figure out where your stress is coming from and create a map to address some of these stressors. Next, feel free and go to justinhealth.com and click on the Become a Patient box. Fill it out and you'll get all the initial paperwork with the metabolic assessment and all the questionnaires that will help evaluate just various symptoms that could help give light to what your hormonal imbalance is and where it's coming from. And from there, we can always set up a complimentary no obligation consult, and we can at least go over your options. The options out there in conventional medicine really are pretty bleak, basically consisting of birth control pill, which just shuts down that whole feedback loop. It does very well at cutting out symptoms, but as you know, we'd have this natural rise and fall of estrogen and progesterone throughout our cycle, and the birth control pill just shuts that down. It doesn't actually fix the imbalance in that whole beautiful symphony. And then antidepressants essentially are just fixing or just covering up the symptoms of the imbalanced hormones. So if we fix the hormone balance and we get that at a more even level, the mood and all of those symptoms become addressed. But antidepressants only cover up the symptoms, and there are lots of side effects from them, whether it be libido loss, decreased sex drive, and or weight gain. So there's a way you can do this naturally just by fixing the nutrition, fixing the body, fixing the physiology, where symptoms resolve on their own as a result of just being healthy. And again, you're only one decision away from getting back your health. You're only one decision away from getting back your health. So again, make the choice. We've given you a lot of options and a lot of information here. So I think you have an excellent platform to move forward and to help start getting yourself more healthy. Thanks for viewing this program, and we look forward to any feedback and or questions you may have. Feel free and email office@justinhealth.com and or visit justinhealth.com for more information. Thanks. Have a great day.